So, Mr. James, 68 years old male, complain of back pain. His vitals, temperature 37.5, respiratory rate 16, pulse 88, saturation in room air 96, and his blood pressure 145/87. Okay, doctor.
Hello, my name is Dr. Huda, one of the doctor in the clinic today. I am talking to Mr. James.
Yes, I am Mr. James.
Yes, Mr. James, we are here today to discuss some issue related to your health condition. Is that okay with you?
Yes, okay with me.
Yes, I have letter from your GP stating that you have back pain. Can you tell me more about that?
Yes, for the last 1 month, I have this back pain all the day and the night.
Okay, and before this month, everything was okay?
I'm not feeling this back pain before 1 month.
Right. And throughout this 1 month, is it increasing or the same?
I feel it's increasing, yes.
Okay. Did you notice anything increase this back pain?
No, it's present in if I at rest or even when I'm moving.
Same. All right. So do you notice anything, maybe something relieve this pain throughout this 1 month?
I'm trying paracetamol and some brufen, a little bit help.
Okay, very sorry about that. And with this back pain, can you just tell me where the side exactly?
It's present on the middle and lower back.
Right. Okay. And from 1 to 10, and 10 is the severe, how much do you grade this back pain?
6 to 7, sometimes up to 8.
I'm sorry about that. And can you describe to me more about the nature, or how does it feel?
I feel it like heaviness, sometimes compression. No specific description for it.
Okay. And did you notice that it's go any other side, or just stay in your back? Does it go, for example, to your leg?
No, it's present mostly in the back.
Right. Okay. And okay, so do you have any medical condition previously other than this back pain that you have in the last 1 month?
Before I have only high blood pressure, and I'm taking amlodipine for it. And I was having this year having 2 attacks of chest infection, and I was admitted and given medication.
So you have this infection in the last 1 year, right?
Yes, twice.
Okay, and you admitted to the hospital twice.
Yes.
Right. And did you given any reason for this infection?
They told me bug infection in your lung, and they gave me some antibiotic and medication, and I was okay after that.
Okay, so you receive an antibiotic and medication by a blood channel, right?
Yes, at the time before.
Right.
Last
Okay.
attack before 6 months.
Before 6 months. Okay. And other than this chest infection and raising in blood pressure, any other complaint?
No, I passed the stone before 1.5 years only, nothing else. Otherwise, my high blood pressure, and I'm taking amlodipine, and it's controlled. Today only I did not take the tablet.
Right. Okay. So I will ask you about your weight. Any changes in your weight?
I didn't measure, but I feel my clothes became looser.
But you didn't measure it, right?
No.
Okay. And since when you noticed that your clothes are not fitting? Is it
For the last 2 months. Last 2 months.
Right. Okay. And do you notice any changing in your appetite?
I'm not feeling good appetite.
Okay. All right. Okay. So do you have any lumps or bumps anywhere in your body?
I didn't notice that.
Okay. So now I will ask you further about, do you have any control over your water work?
Yes, no problem with this.
About your back passages when you pass motion, any control over it?
Actually, no problem, but I have hard motion also.
Right.
Last times I am going to toilet every 4 to 5 days.
Okay. Right. And do you have any heartburn,
No, I'm not feeling that.
acid burn,
No,
stomach pain?
no.
Do you drink water more than usual?
Yes, I drink water because I'm not eating. Because also my friends told me because of this hard motion, you have to drink more and more water.
Yeah, right. Okay. And do you have anyone commenting that you are looking paler than usual?
Ah, yes,
Mm,
my son told me that.
right. And since when they noticed that?
This comment I heard before 20 days.
20 days, right? So, do you have any episodes of passing like black stool or blood from your back passages?
No, I didn't
Any
notice that.
right. Any discoloration of your skin? You sometimes under the skin there is you notice some bruises or bluish discoloration.
No.
Right. Do you have any difficulty in breathing?
Yes, sometimes when I am walking.
Right. So any difficulty in breathing at night? You sometimes notice you wake up when gasping for air sometimes.
No, no, this never happened.
Never. Any dizziness from changing position from sitting to standing?
I feel dizziness, but not related to change position. Sometimes I
Right.
feel dizziness.
Yes, I can understand that. Okay. So do you have any dryness in your mouth or
No,
your skin?
no,
Right. Okay. So do you have any joint pain?
no joint pain.
Okay. Regarding this back pain, I just will back and ask you about any stiffness with this back pain.
No,
Right. Okay. So, okay. So do you have any like swelling in the front of your neck,
no,
difficulty in swallowing,
no,
any skin rashes uh, anywhere?
no skin rashes.
Right. Okay. So now, Mr. James, do you smoke?
I was smoking about 10 cigarettes for the last 10 years,
Yes.
but
Can
I stopped 2 years back.
okay, advise you, Mr. James, to stop smoking because it's harmful in your case.
I
And
already stopped, Dr. Ahoda. I already stopped.
okay, already stopped. That's good. Okay. So do you drink alcohol?
Occasionally.
And any episodes of sometimes binging, drinking more than the recommended amount?
No, never.
Okay. Right. And what's your job?
I'm retired now.
Okay. Previously?
I was a banker.
Okay. All right. And socially, at home, are you well? You cope with your daily living?
No, because the pain, I'm not feeling okay.
I can understand that. Okay. So, all right. Okay. So before, just I'm sorry to ask you these questions, but any previous episode of using any illicit drugs or by a needle or
No,
right. And other, you tell me that you use the medication amlodipine. Have you ever changed the dose recently, or you complying with the treatment?
no, I am compliant and it was controlled. Only today exception because I didn't take my medication.
Right. Okay. So, do you have any raising in your body temperature?
Sometimes I feel that.
Right. Any sweating?
No,
Okay, okay, and maybe I'll ask you any contact someone in the TB or travel
no.
into a certain area, right? Okay, so now Mr. James, I will examine you, all right?
Okay,
Okay, so I will took look to his back for exposure to looking for any deformities, maybe kyphoscoliosis, loss of lumbar lordosis, and
normal.
any scar, normal, right? And then I will go to
But
look,
there is tenderness in his back, okay? When
right,
you examine for the back, you examine for tenderness. Also, there is tenderness on his back.
right. And maybe I ask him to move side from side and bending forward any limitation or pain.
No limitation.
All right, okay. But pain on movement, as he
There is
mentioned.
pain in movement. There is tenderness on palpation.
Okay, so now I will go to his eye looking for any pallor and any jaundice.
There is pallor, no
Right.
jaundice.
And then I took a look to his mouth, open his mouth, raise his tongue, looking for any cyanosis or abnormal or soreness.
Normal.
Right. And then I go to his neck, looking, just examine the lymph node of his neck.
Okay, you didn't appreciate any lymph node.
Right. And then I will examine his chest, mainly lung for any abnormal sounds, and checking mainly chest movement apically and basally.
Normal.
Right. And then I went to his abdomen looking for any organomegaly, such as mainly splenomegaly.
No organomegaly.
Right. And do right. And then I will go to his leg, just checking for pitting edema.
No beating edema.
Okay. And then I will go to lastly to his hand, checking for any leukonekia, any clubbing.
Nothing there.
Then I would check his pulse. Is it regular? No tachycardia, bradycardia.
It's regular.
Yeah. And then I go to his wrist, asking to measure the blood pressure.
Blood pressure, it's written as it's in the vitals.
As standard and outside, right? And then I will ask to measure blood pressure sitting and standing.
No
Any
change.
right? And then I will check for proximal myopathy.
You did not appreciate also.
Now, Mr. James, can I ask you what's your concern?
What do I have, doctor?
Right, I highly appreciate your concern. So after I take in history from you and examine you, the reason for your back pain that you have in the last 1 month is mainly most of probably it's due to condition called multiple myeloma. Have you heard about this term before?
I hear, but what you will do for me? Yeah, doctor?
Yes. So this is a disease in which there is affection of certain blood cells in your body. So what that's lead is to symptoms that you have, such as the back pain. And the reason for the back pain, many possibilities, maybe could be a fracture, right? So what we need to do is to run for you some blood tests and even imaging. And then we will sit further to discuss the plan of management.
Okay, so still have 2 minutes, doctor.
Right.
Do you want to add any questions?
I will add maybe asking about his water work, any frothy urine, any puffiness around his eye sometimes.
Yes, there is frothy water work. Okay.
And we'll ask about any family history of cancer.
No.
Right. And lastly, in the examination, I will check his that's all I will do, doctor.
Okay. Okay. Thank you, doctor. Well done, doctora. Very well done. But I want to ask how you guess the case now. What is your positive finding? Make you put the diagnosis?
Yes, this is a 68 years old man, so his age, and he complaining of maybe signs of symptoms, or mainly symptoms of hypercalcemia in the form of constipation, and this back pain could be precipitated by this hypercalcemia.
What else you have to ask about hypercalcemia? What else other question you should cover regarding
Yes.
hypercalcemia?
So first I will ask about his water work, polyuria, polydipsia, heartburn,
Okay.
acid burn for peptic ulcer, asking
Mm.
for even any passing stool, and he mentioned that he passing stool previously.
I give you stones and you ask about polyuria and polydipsia. Okay. And you
Yes,
ask about
constipation, and I ask
constipation.
and I ask about heartburn, acid burn.
You ask about other bone pain and psychiatric.
Yes, I didn't ask
Ask
about
other
no
bone pain and psychiatric also. This is for calcemia.
hypercalcemia. Yes,
We know
other
the crab. Okay. Everyone knows the crab, crabby or crab.
yes,
Other. Now we cover C and R.
yes,
Anemia you asked about in one comment that you are paler than before.
okay, yes.
Then
And renal involvement by asking any frothy urine. Lastly, previously I asked in the history any changing in the water work, but more specifically asking about any frothy urine or puffiness around your eye for renal
yes.
involvement and amyloidosis.
Okay. I give you also recurrent bacterial infection. This is one because it's a crabby. C
Right.
for hypercalcemia, R for renal involvement, A for anemia, B for bone, and I for infection. Okay. So bone pain, recurrent bacterial infection, and you should ask about hyperviscosity. I give you dizziness. You should focus here for headache, blurring of vision. This area also is very common in multiple myeloma. Okay, doctor. This is the only
Right.
question or two questions you did not ask. What investigation you will do for this patient?
Right, from general investigation from complete blood count, renal function test, liver function test, and
Renal
electrolytes.
function, what to expect to find? Let me take one by one for everyone to get the maximum benefit of this topic.
Yes, renal function test looking for renal impairment.
Yes, it will be creatine high or urea high. And what else?
Electrolyte mainly looking for hypercalcemia.
Yes.
Complete blood count looking for anemia.
Mm.
Yes,
Blood film, what you will find in this patient?
blood film.
You may find rouleau formation because light chain, a lot of protein, so light chain. Okay, what else you will do?
Yes,
This
I
is
will
basic.
urine analysis.
You may find
Proteins for proteins.
Do you remember the name?
Benz-Jones proteins.
Okay, and no other than urine. What else?
Yes, doing a bone marrow aspirate, looking for plasma cell more than yes, looking for plasma cell.
More than?
I don't exactly, but 30%.
No, 10%. Plasma cell more than 10%. Okay.
Right.
And you will do serum protein
Yes.
electrophoresis
Yes.
for
for immunoglobulin.
yes, and the monoclonal paraprotein. Paraprotein is light chain, and other immunoglobulin. What is the most common immunoglobulin in multiple myeloma? Will be high.
IgM.
IgG and IgA. IgM in Waldenström macroglobulinemia. IgG and IgA. Maybe
Right.
light chain, IgG, IgA, IgD, IgE, but IgM mostly in other Waldenström macroglobulinemia. Do you want to do any imaging for the patient?
Yes, I would send for investigate more about his back pain. Maybe sending for X-ray initially, sending for MRI, and
Which is better
maybe
for the patient with multiple myeloma?
CT or even radioisotopes scan.
No, MRI is better because MRI is very sensitive and they can detect any infiltration in the bone marrow. But
Right.
skeletal X-ray, this X-ray can only if there is lytic lesion already happened, more than 30 or 50% of the vertebra has been eaten. Okay. Radio,
Okay.
this nuclear scan will not show anything because it show osteoblast, will not show. Here in your case, multiple myeloma, there is osteoclast activation. Osteoclast, this is responsible for destruction of the bone. To know the idea, destruction, this will take calcium from the calcium from the bone will go to blood, lead to hypercalcemia in the blood, and there will be calcium low in the bone, leading to brittle bone. It will be easily fractured. Okay.
Okay.
So you told basic investigation, CBC,
Yeah.
you did renal function, you did peripheral blood film, you did for electrolyte for calcium, it will be high, you did protein electrophoresis, you found urine Baines-Jones protein, you found in the protein in the serum monoclonal immunoglobulin and the paraprotein, you did a whole body MRI, you did bone marrow biopsy, plasma cell, right?
Right.
What other differential for this patient can be?
Right. Okay, so top differentials, multiple myeloma. Second could be cancer with metastasis, especially with his age 68. Could be cancer
Yes.
with bone metastasis. The other differential could be even discitis or tuberculosis. As he mentioned, he
Yes.
have previous hospital admission with IV treatment. Other could be osteoporosis with the fracture.
Okay. If osteoporosis in male, what you want to examine for? What you will do test?
Yes, testosterone level maybe.
Okay. Right. Exact. Excellent, doctor. Could be this case MGUS?
In MGUS, mainly the patient is asymptomatic.
Yes.
Maybe just there is hyperviscosity and raising immunoglobulins, but no associated symptoms such as multiple myeloma, back pain, signs, symptoms
Oh,
of hypercalcemia.
excellent,
So,
doctor. And the plasma cell also less than 10%. Okay, if this patient, same patient like this, and you found plasma cell more than 10% and the high protein, but there is no symptom, what we are calling this?
um, in the same patient, Waldenstern,
No,
hypergam.
same patient. Now this patient has anemia and he has bone pain and he has what else we said? And he has renal affection. By frothy water work, by he told you, Bear, I have bone pain. Now he has a condition called end organ damage related to multiple myeloma. If this patient, okay, you did like lab, but you found plasma cell more than 10 and the monoclonal protein high, but there is no end organ, no hypercalcemia, no anemia, no lytic lesion in X-ray, nothing. What we are
Yes,
calling this?
yes.
There is name.
Nothing in my mind, doctor. I don't know.
Okay, we are calling smoldering myeloma. Smoldering myeloma means asymptomatic myeloma because we will not treat until there is symptoms. Okay,
Oh,
treatment for multiple myeloma if symptomatic means the patient with this symptom plus confirmation by the imaging and lab. Do you know any medication used for multiple myeloma?
mainly chemotherapy, targeted therapy, but yes.
Okay, chemotherapy, some bad names like lenalidomide or thalidomide. You can do stem cell transplant. If old patient palliative, like alkylating agent like melaphalan or cyclosporin plus prednisolone. Okay,
Okay,
excellent, doctor. Very well. This
thank you.
you can take full mark والله for this because
But
uh, mm,
yes, I just have a problem with the last discussion, like the investigation all the time and the treatment for any disease.
try
Um,
to try to organize for it be organized, but also it will be individualized because previous case with Dr. Ahmed, you will do investigation, first investigation for screening, for example, for confirmation, for differentiation, and then for operability. For other majority will be investigation to confirm diagnosis, investigation to rule out other differential, investigation for complication. Okay,
okay,
in
thank
majority it will be like this. For your condition, you can do like this: urine test, blood test, imaging, and aspiration of bone marrow. You can do it like this. Or you can make it like, for example, you remember Krabby, we told calcium, as you mentioned, I think you did this. You did calcium for hypercalcemia for bone profile, renal for renal function, A for anemia, okay? And the bone you will do imaging. It will be like this, but better to do imaging alone, blood test alone, urine test alone, and bone marrow aspiration alone. It will be like this. But your clinical judgment is okay. Don't worry about this. Even you feel it's not organized, but it's very okay.
Thank you, doctor.
Okay, thank you. Do you want to ask any question?
No, thank you.
There is one point information if he asked about the staging, only staging, international staging. He will not ask, I think, inshallah, but only beta 2 microglobulin and the albumin. Beta 2 microglobulin increase, worse prognosis. Albumin decrease, worse prognosis. These are used. If he ask. تفضل دكتور أحمد.
Thank you, Dr. Tala. So the clinical communication can make any doctor to fail even by the history in this long case.
Clinical
So
communication
better to be
skill.
organized, yes.
Clinical communication skill, which is skill C, is very dangerous. I said before. Why? Because the pass mark is 11 out of 16, and it's present in the talkative stations. Too long, too communication. So if you are not talking well to the patient in history, organized focus, as we mentioned before, and in the communication, I mentioned before, if you took one unsatisfactory, you will be at risk. Why? Because you will have only one mark. If you got another borderline, this is skill out. If one skill failed, you fail the exam. You got the idea, Dr. Ahmed? This is the problem of communication skill. It's, by the way, it's easy skill and in the same time dangerous skill. Easy skill because you should memorize the history, ask it, organize it, okay? This will be by practice. I think you see Dr. Hoda, she is not making a long pause in questions. She's asking one question and waiting the answer, and she already has another question in her mind. This is the plan. It will be like this. And the second question, next question, it will be related. This will be by practice, Dr. Ahmed. Don't worry. This is well known. Okay.
Okay.
Why it is easy? Because it will be, you can do it even if you don't have a partner. You can do it with yourself. You can do by yourself if you have a scenario in front of you and you are asking and answering. You can do it with partner. It will be good. With partner and the supervision, it will be good and good. Okay. Why it is risky? Because as I told you, it pass mark is very critical in it. This is the problem.
Okay. Thank you very much.
You can explain multiple myeloma that you have cancer in your blood and affecting the bone and causing the symptoms that you have. Any other questions?
Thank you.
Anyone want to ask
So
any question?
appreciated, Dr. Tala. Thank you very much.
العفو يا دكتور أحمد. Don't worry, Dr. Ahmed, about the beginning, always difficult. Practice will be okay. You will check yourself. I will tell you now. You check yourself after 10 days and after 20 days, and you see the difference. Wallah.
Inshallah.
Any other questions before we go?
Thank you.
Okay. Assalamu alaikum wa rahmatullah.
عليكم السلام ورحمة الله وبركاته.